All right. Thank you. Hi, everyone. I'm glad you had a nice time at the SSDP Awards 2021. And now we are live with some of our amazing speakers. We have Maria-Goretti from Ghana, and we have Charity Monareng from South Africa. We'll be talking about this amazing topic. The topic is law reforms for effective response for drugs and related issues. And today we'll be talking about these issues in respective to the African continent. And we'll be looking at the laws as they are related to incarceration of people who use drugs with no alternative for rehabilitation. This topic will help us to highlight some of these sections and clauses in some of our law books in African countries that are unfriendly to drug users and humanity. This will prepare us for our advocacies for law reforms with specific references in various law books. And permit me to tell you that some of our speakers are individuals who have years of experience in advocacy across the African continent. Maria has worked with various non-governmental organizations in the area of drug policy reforms. Yeah. So the first speaker is going to be Maria-Goretti, and she's a legal practitioner in Ghana and the African consultant for international drug policy. Yeah, you have the floor.
Okay. All right. Thank you, Moro. I think we lost you at a point in time. Yeah, so it's really a great pleasure to be joining the SSDP family today, and more importantly, to be doing this discussion around drug policy, especially in the region. As an advocate, I'm always happy to be with colleagues whom I share ideas and also learn a lot from many of you as we discuss the issues that borders around Africa and how possibly we can we can find solutions to these problems. So basically, my task today, together with my colleague Charity, is to look at law reform for effective response to drug policy and drug-related issues. And so, having worked as an African advocate and as well as interacting with a lot of stakeholders within the region, I've had the opportunity to at least have a fair idea as to what our laws look like or how our drug policies look like in Africa. And I have always described African policies or our drug policies as they have been portrayed to look like war policies, with soldiers and law enforcement officials always carrying out prohibitionist practices that kind of tear apart communities and people's lives. Now, in 2018, my organization, IDPC, together with the West Africa Commission on Drugs, had the opportunity to try and do some kind of like a desktop analysis of the drug laws in the region. Specifically, we had to narrow it down to West Africa. But I know this reflects almost everywhere in the continent in terms of the nature of our drug laws. Interestingly, this particular study, when we tried to gather all the drug laws and then try to identify specific issues in terms of whether the law makes specific provision for human rights, protection of people who use drugs. Does it, are there provisions specifically on harm reduction or alternatives to incarceration? Looking also at the proportionality of sentencing in terms of drug-related offenses. And interestingly enough, throughout that study, in terms of the 16 ECOWAS countries that we undertook this study, most of the laws approached the issue rooted in the prohibitionist interpretation of the International Drugs Conventions. And all these laws have gone for decades without being on question in terms of how relevant, how effective are they in terms of addressing the world drug situation or addressing the fundamental issues around drugs in the region. And I have always said that it appears that policymakers are comfortable, or they just find it convenient to continue to do what they are doing, knowing very well that these policies are not working, or they are not yielding the desired results that we have all been looking for, because they are dominantly focused on punishment. All we do is to criminalize and punish people for drug-related offenses. And even if you look at the laws within the sub-region, they vary greatly. For instance, in some countries where persons who had drugs for personal use could get a sentence like 2 years, 3 years. In some other jurisdictions, you will find people getting sentences such as 25 years for mere possession. And I'm like, there's vast variation in terms of the laws within even the same sub-region. And so, of course, there's need for us to begin to think around these laws as to whether they are effective or not. We all know, policymakers know that it's not effective, but it appears we find it very convenient doing that because it is something we think we can use to control these marginalized groups and marginalized communities. Now, having identified a lot of these problems, which many policymakers know as the fundamental problem, how do we address these challenges, or in what way can we address these challenges in order to have a very effective response to the problem in Africa? And I have always said that Africa, we have always we have placed so much emphasis on criminalization, thinking that using punitive measures will help deter people from using drugs, because all the time you hear policymakers saying that if we enhance the sentences, if we enhance the punishment, it will keep people from using drugs. But that is not the case. The evidence keeps telling us, even in the World Drug Report, every year when this is brought up, you see that the situation is getting worse and worse. And that means that the policies themselves are not working. And why are we particular about the issue around criminalization? The problem with the laws are that the more you continue to criminalize people, the more it exacerbates the problem. Because as long as you criminalize people who use drugs, that you increase their health risk. We all know that, because there is that fear of arrest, and there is that fear that if I open up to my problem concerning this, I could be in trouble with the law. And so people will hide to do things, risking their lives in a certain way that is not healthy for them. And so the criminalization aspect is one of the problems causing the health complications that come as a result of drug use. And so long as we continue to criminalize, we will not be able to address a lot of the issues that we have. One other issue that criminalization has created is what I call social risk. because society tends to think that people convicted or people who have been who are using drugs or have had some offenses committed are criminals. And so there's that stigma, and that can lead to a lot of discrimination, including reduced support for health-led responses. Because once society sees you like this and try to give tax and all manners of name calling to such a person, it creates a lot of problems for the individual, because you cannot access a number of things. Recently in my country, a young man of 25 years who had gone to jail for some minor offenses that he's committed was released. And this gentleman had written his SSDP examinations and had very good grades and had been placed. In my country, we usually have these computer placements. So when the results are out, automatically you are placed to a particular school, your first choice and second choice and third choice. This gentleman has been placed, to his first choice, and the school refused to take him because he had a criminal record. So imagine such an albatross on the neck of young people who, one way or the other, through their drug use, are denied of their legitimate right to access their education. So these are some of the challenges of criminalization of people who use drugs. And we have always argued that these are non-violent offenders. People are just using drugs. They are not criminals. And so why would we be punishing them for such actions? And so there's need for us to begin to reconsider the policies that we have. And so how will we be able to address many of these challenges, especially with the laws that we currently have in the region? I have always argued that for us to be able to address many of these challenges, first and foremost, there is need for legislative reform. So long as you have all the wonderful programs, service provisions put in place to address the problem, so long as the laws continue to criminalize people, it's still going to be an impediment on people access to these services that you have put in place. And so it is important that we need legislative reforms, or we review the laws to meet current situations, so that people who use drugs are no longer criminalized. And I have always said that I think the first step is decriminalization. We need to remove all criminal sanctions for personal possession for use. Once we do that, we can then take other steps to support that initiative, because decriminalization alone is not the solution to the problem. And so, of course, it has to occur with other programs. It has to occur alongside with other programs and related interventions, so that we can achieve those desired results. And so we need to begin to think around drug policy, especially as a continent, by ensuring that we do a reform. There's a legislative commitment, a political will for that commitment to review our laws towards removing criminal sanctions against people who use drugs. And by doing that, you give people the opportunity to even speak up about their own drug situation. For instance, once that is done, people can even access information in terms of how risky is it for me in terms of consuming this drug or that drug. I have information to be able to guide me, to be able to know what sort of drug I'm even taking. So it gives you the opportunity. Unlike where it's criminalized, people have to go underground in terms of the criminal market, where all sorts of mixtures are taking place. Nobody knows what kind of mixtures of substances are being put in place, and people go in to consume them, and then they develop health complications, even to the extent that because of the criminalization, people have to use share instruments like needles. But where you remove criminal sanctions and allow people that opportunity to explore the available resources and services available, it reduces significantly and improve health outcomes for people. We have seen examples of places such as Portugal and other jurisdictions where people have and countries have taken that line, and today we are seeing a lot of changes. We are seeing a lot of improvement in terms of the life, the social outcomes. There's improved social outcomes as a result of some of these policies that we have, such countries have undertaken. I've always heard arguments by many policies saying, if you decriminalize, you are going to open the floodgate for people to use that. That is not true. When Portugal decriminalized in 2001, what did we hear? It was going to be the half of that, it was going to be this and that. Today, we have examples of countries that have done so, and yet they are able to manage, and even we can see how they are able to manage and improve the lives of these people, and they're living normal lives. They're able to function effectively, and they're doing their activities more effectively, and they can access health services. And so we need to begin to think around that as Africans and as policymakers. Until we do that, we will not be able to address the challenges of drugs, because we have criminal for so many years. Has drug use reduced? That is the question I've always asked. We have always enhanced, or we always put in place such draconian laws and policies, but has drug use ever reduced? No. That is the question. We had several policy issues that are not really yielding the necessary results. And so as a continent, we need to begin to address specific issues around that and take very bold steps as a continent to review our laws, so that at least we will be able to address many of these fundamental issues. And also the fact that if you decriminalize, you are able to solve a number of issues. So for instance, public health issues, you are able to address issues around stigma. Resources will even be channeled to address specific issues. Because if you look at the amount of money we put in law enforcement alone, it's so much, and it's wasted, because you are all the time law enforcement agencies are chasing the small fries. Police officers find it very convenient to go after the small fries all the time. At least they can make headlines all the time that they have arrested 100 people who are engaging in drug use in this community, and that is enough. And even the abuse, the human rights abuses, people take advantage of this supposed war on drugs and abuse the rights of people. We have seen studies that have been done by Youth Rights Nigeria, where police officers take advantage of female drug users and abuse them just because of drugs. And so it is important as a continent we begin to look at some of these challenges and at least look at what other countries have done and be able to pick up from there, and also do same, so that at the end of the day, our youth and our future leaders will also benefit from all these great policies that are yielding great results in other continents. I would like to pause here, and then probably my colleague can come in, and when questions come, I'll be able to address them.
Thank you very much, Mrs. Maria-Goretti, and that was so insightful. And now I'll be calling on our next speaker, who is Charity Monareng. She's the Parliamentary and Policy Research Officer at TB HIV Care, and is actively engaged in national, regional, and international advocacy work for drug policy reform. She is a PhD candidate at the University of Cape Town in the Department of Public Law, and serves on the board of the South African Network of People Who Use Drugs, Stand Action, and Digital Girl Africa. Permit me to call on our next speaker, Charity Monareng. Charity, you have the floor.
Thank you so much, Moronfolu, and thank you, Maria. So I'm going to cover 3 aspects. I'm going to be highlighting how current drug policies are an impediment to development, as well as the adherence to the achievement of the SDG goals and this African mantra of an AIDS-free Africa. I'm also going to highlight the gender perspective of the current drug laws that we have, as well as conclude on what can be done, and possibly give some practical advocacy strategies. So as we know, we have just about a decade remaining to achieve our SDG targets. And the failure for African countries to to reform punitive drug laws in the region is making the future of development very bleak and the achievement of these SDG goals unattainable. So many countries have continued and continue to ignore and acknowledge the impact of prohibitionist drug policies on the development, which is very alarming. Which is very alarming because global drug control policies are essentially actually a cross-cutting development issue that impacts several SDG targets, especially SDG Target 3, which is ensuring healthy lives and promote well-being for all and all ages. This is directly related to drug use, and member states should be reporting on this, as well as the coverage of treatment. However, African countries have failed to do this, and they actually failed to acknowledge the drug trade as a key challenge to their development. So how do these current drug laws impede development? So I've identified 4 goals that I'm going to address each. So the first, it's Goal 1, Goal 2, Goal 3, and Goal 5. Goal 1, ending poverty in all forms everywhere. So in the absence of licit livelihood opportunities, many small-scale farmers in Africa have resorted to growing crops that have been deemed illicit, such as cannabis and coca. And as a strategy, they use this as a strategy to basically to cover food insecurity. So in South Africa, for example, cannabis production among small-scale farmers has produced some level of food security due to it being a very low-maintenance crop. And so farmers use this, and they've chosen to use this because it's easily transportable and is very transportable to a significant profitable market. So there are millions of people that depend on the income of cannabis. In most parts of Africa, like South Africa and West Africa, cannabis and coca are the only viable crops. And this contradicts the misconception that participation in the drug market is driven by greed and wealth, when the actual reality of people is that they are poverty-stricken and do it for survival. So in order to achieve these goals, governments must instead break the continuous cycle of punishment where people who use drugs continue to be stigmatized, unemployment, and this perpetuates poverty, which is linked to the world drug situation. These repressive responses to drugs have been mainly counterproductive, especially among the most vulnerable. The criminalization of drug possession and use is disproportionately affecting the people living in poverty and ethnic minorities in both rural and urban settings. Goal 2, ending hunger, achieving food security, and improve nutrition and promotion of sustainable agriculture. So many governments across Africa and across the world we've seen have resorted to crop eradication using aerial spraying or burning of large fields of crops. These actions have exacerbated food insecurity, as mentioned earlier, for the whole community by destroying a means of livelihood for farmers involved in this illicit crop cultivation. These approaches have contaminated water supplies as well as soil and the destruction of nearby food crops. And during these eradication efforts, they have degraded large parts of lands in Africa, which means that people have found it very difficult to grow other crops because the soil is destroyed as well as their water supplies. So the indiscriminate burning of cannabis farms and coca farms has led to the destruction of food crops. This has resulted in people losing income to enrich their families, as well as famine across Africa. With many small farmers being women, drug policy strategies that have been adopted have obviously prevented women from being able to feed their families and create sustainable livelihoods for themselves. Goal 3, ensuring healthy lives and promoting the well-being of all people. So the 3 UN conventions that underpin the international drug control system aim to improve humankind's welfare and health. And states can only achieve these objectives by ensuring that the rights of people who use drugs are acknowledged. So for the longest time, for the past 5 years, a lot of member states in the UN high-level meetings on sustainable development have had this recurring principle of leaving no one behind. And Africa has always talked about this agenda of achieving an AIDS-free Africa. However, this will not happen if people who use drugs are ignored and continue to be stigmatized. So many countries have continued to criminalize drug use, the possession of very small amounts of drugs for personal use, and this has created lots of health and human rights violations and overcrowding in prisons with minor non-violent offenders leading to severe overcrowding. In South Africa last year, it was reported that over 60% of the prison population in male prisons was young people in prison for drug offenses. And lastly, goal 5. Achieving gender equality and empowering women and girls. Current reports across the globe show that many women and girls are going to prison and serving much longer imprisonment sentences. In the context of Africa, women drug users are more stigmatized than their counterparts, male drug users are seen as normal. However, with women that are drug users, they're seen as being defiant, and which means that they need to be punished for their action or their habits. So women and men are affected differently. Women by nature go through many different social issues such as discrimination, gender-based violence, just to name a few. These specific needs need to be factored into policies, into different approaches that we use to ensure that they are taken care of. However, this has failed to happen because of repressive drug laws. Women do not form a majority of populations, but their numbers have increased globally and in Africa especially. So globally, women are incarcerated for very non-violent drug-related crimes. So they'll be incarcerated for trafficking drugs or being associated with partners or their children who are drug users or drug dealers. So essentially, the war on drugs has made females very vulnerable to arrests. And this brings me to my next point on the gendered perspective of our current drug policies. So as mentioned, the drug war has become problematic for women. This is mostly because society's new criminal, I'd say, is a non-gender drug user. So, drug use has become one of the few crimes where women's rates are coming closer to men's incarceration rates. So legislative laws of the war on drugs have made women very vulnerable. And one of these is, like I said earlier, a conspiracy wars. So these are wars where if a woman is suspected of being any way romantically involved with a man that is a drug dealer or whose son might be a drug dealer, they are used as key informants in the promise of minimum sentences. However, this is never the case. Another aspect of these laws is the incarceration or prosecution of women who use drugs and are suspected of using drugs while they're pregnant. In 2014, it was found that several African countries, HIV prevalence among women who use drugs was significantly higher than their counterparts. 21% versus 7.5% in Senegal. And in Tanzania, 45% of men and 72% of women who injected drugs were HIV positive, which is 5 times the rate of HIV infection in drug users, in people who use drugs, who inject drugs. Substance use, as we've seen, has been essentially the main cause of gender-based violence. In South Africa and across the globe, I think, we've seen an increased rate of gender-based violence cases during Corona, and this has mostly affected people who use drugs. Not only are they unable to report these crimes to the police, but a lot of women who use drugs have been killed by their partners because of this fear of not being able to access services or this fear of not being able to report any violence that happens towards them. So women who use drugs are subjected to gender-specific discrimination, social exclusion. This is common everywhere in Africa and sure across the globe as well. and they tend to have less access to harm reduction services. And last year, during a global initiative study on drug use in Southern and Eastern Africa, it was found that a lot of women that use drugs were not even accessing services because injecting drugs as a female in their own community as people who use drugs is a stigma. And so they're not wanting to be known as people, as injecting women, has prevented them from wanting to access these services. So essentially, the involvement of women in the drug trade reflects the decreased economic opportunities and very low political status that women face in everyday life. Even when women may not be directly participating in drug use and the drug trade, they are often responsible for mitigating the associated risks for themselves and for their families. And they are forced to carry the double and even triple brunt of care when families break apart and community life deteriorates. So what can be done to address these issues? Number one, and I think is the most important, stay informed. You need to keep up to date with discussions that are happening at the regional or international level by either reading summaries of reports or actively participating in these meetings. So always stay informed. IDPC also hosts a private Facebook group to share information on upcoming opportunities, and also it's important to engage in other regional drug policy meetings. Number two, coordinated engagement. Join any networks that share the same vision or the same goal or the same agenda as you, including harm reduction and drug policy networks, just to help coordinate inputs, learn from other organizations, share best practices, see what works in one country, and try and adapt that to your context. Three, establish, where needed, or if there aren't any, national civil society networks and other organizations to advocate for drug policy reform. This is very key, and we've seen how it has worked in Canada, where organizations with the same agenda have come together and amplified the voice of people who use drugs, ensuring that their rights are amplified and that government actually knows the plight of people who use drugs. Consider approaching local government. So in South Africa, there are three levels of government. We have local, provincial, and national. National essentially comes up with the national policies and they come up with the national budgets. Provincial is basically responsible for prioritizing what's important in the different provinces. And then local government is where you have your municipalities that actually go out and do different programs. So for the longest time as advocates, we've tried to rally or advocate with national politicians, when in actual fact, a different strategy would be advocating for with local government. Local government can easily be the ones that, the city can easily be the one that's providing a harm reduction service. In South Africa, we have one city-funded harm reduction program, and the city has funded that, even though policy came out much later than the actual program was initially started. But having a city or local ally that can help you ensure that services are provided for people who use drugs is important, and even advocating for different social issues like gender-based violence among women or people who use drugs. And actually, proactively using the full range of media. In South Africa, we found it very useful to partner with very reputable media houses where if anything comes up relating to drugs, they will always come to us to get confirmation of whether this is fact or false. And this has been a very key ally for us because we've been able to educate the public on what's going on, what's really going on, this current state of people who use drugs, the current state of, for example, national policies that are affecting people who use drugs. So it's important to proactively get engaged with media houses. So I mentioned the SDGs, and I think as advocates, again, we've tried to piggyback on the HIV wagon on trying to advocate for people who use drugs. But now, with 10 more years to go to achieve our SDG targets, we could start using the Sustainable Development Goals as a tool to advocate for drug policy reform on the basis that if we are ignoring the rights of people who use drugs, we definitely will not be able to achieve our SDG targets by 2030. You also need to, if there aren't any networks of people who use drugs, help establish those networks. You can't advocate for the rights of people who use drugs without actually consulting with people who use drugs. And so local knowledge, they are the knowledge that we need to make our voices legit. And so ensuring that we are establishing or helping establish these regional and national networks of people who use drugs. You also need to keep local UN staff accountable. There's a UN common position, and that's a document that I think it's one of the most progressive documents at the UN, and we need to start ensuring that UN staff are using that document. And lastly, promoting awareness on regional documents that can be applied all across the globe. As Maria mentioned, the West African model drug law, it's a blueprint on how to reform drug policies, and that is a very key tool that we can use across Africa to ensure that our drug policies are aligned with human rights and people-centered approaches. Thank you.
Yeah, thank you so much, Charity, and I'm sure most of our participants have a lot to ask now. Yeah, but from my hand now, I would just like to ask these few questions from my hand in relation to young people and SSDP, because I'm sure most of the participants here are people who are willing to learn about how to go about their advocacies in their various campuses and their various regions. My first question goes to Mrs. Maria. You said we have a reactive policy from our government across West Africa. So for your years of experience, what you and IDPC and other partner NGOs be able to do to see how we can bring the government closer to people with drugs so that things can be more flexible between the two bodies, because we know without the government it will be difficult for us to actually implement most of the things we have on paper. So what have you been able to do in the past?
Thank you very much, Moronfolu, for this very important question. It's good you are bringing this particular question up, because many of us have always carried out our advocacy in kind of like in isolation, when in actual fact there are some key players in this whole discussion that needs to be part of that conversation. And until we do that, we will not be able to address most of the challenges, because as long as you propose beautiful policies and you don't get the right people to buy into those policies, you cannot have that change that you are looking for. So over the years, what we have done as an institution and partners within the sub-region is to ensure that we empower a lot of the civil society organizations by building their capacity to be able to engage, because as IDPC, we cannot be on the ground all the time at the various countries to engage. So what we do is try to build the capacity of civil society organizations in the area of drug policy and how to even communicate your message to these policymakers. Because of course, when you are going before these people, you have to package your message more beautifully so that they can also get along with whatever arguments you are making. We have also done a lot of policy over the years to help a lot of the civil society organizations in the region, so that at least they will be empowered to be able to do so. Now, what I want to share from the experience of my own work as an advocate is that, you know, governments by nature will want to do things that are convenient for them. It doesn't mean that what they are doing is the right thing or is giving them good results. They just find it convenient to do it because they just don't want to move out of those silos to do something new that can bring good results. So of course, as civil society and as young people, it's an opportunity for you to move to many of these policy stakeholders and engage them. I've heard a number of advocates always saying that the doors are shut. They are not opening their doors. You don't have to give up. Reform is a long journey and a long process, which I agree, because it's quite frustrating sometimes. You do all your best as a young advocate and yet you are not seeing immediate results. But what I will advise is that We need to engage more often. Don't engage and go and sleep. You need to engage more frequently and more actively. So identify key institutions that you think are relevant in this conversation. So for instance, you know very well that with the area of drugs, the health institutions play a very critical role. The Interior Ministry or the law enforcement agencies play a very critical role. And another critical player are our legislators, because at the end of the day, everything comes before them and they will deliberate over these issues and the law is passed. Start building alliances within that. Even if you identify one ally within the legislators, that can move a lot of things. We, for instance, in Ghana, with our current law, in terms of the reforms that we've had, that is how we build it. So as young people, begin to try to build allies within many of these institutions. Build a relationship with at least one person who plays a critical role in the health sector. Use that person as a point of entry to many of these things that you want to discuss. And I will also advise as advocates that when we get this opportunity, make good use of it. Make sure that you bring your best out whenever you are engaging with these people, and ensure that the relevant issues are brought to bear. And of course, try to utilize a lot of the instruments and resources that are out there. There are a lot of resources that are there for us to build ourselves as civil society. So I believe that as an advocate, you have to continue to engage the media, policymakers, the religious leaders, because Africa, our major problem in terms of pushing across this argument is our religious leaders. They are the people sometimes that place a lot of obstacles, because even when the policymakers are getting along with you, religious leaders will say, hey, if you do this, we will instigate our people against you because we are going to make drugs free for everyone. Begin to engage the religious leaders. And I believe that one time we had the opportunity to meet with various sectors of the religious group, the Christians and the Muslims. And we engage, and at least sometimes it's just the resistance is because they don't understand your message, or they have received the wrong message from the wrong forum, and so they build that resistance. And so you need to ensure that move to them, engage them, and at least they will think alongside certain things with you, and that is where you use as a point of entry to many of your advocacy work.
Yeah. Thank you so much, Ma. That was so insightful and helpful. Yeah. In regards to South Africa, African countries, and Hamid. So, how appropriate are drug law indicators in South Africa?
Please, you were breaking them, Moronfolu. Can you please just repeat the question?
Okay, I said, how appropriate are drug law and drug control indicators in South Africa?
So in South Africa, I think it's only recently where law enforcement agencies started using the number of arrests as police performing. And there was a quota, and they had increased the quota of police arrests in South Africa. And so through advocacy efforts, this changed. And so now police are they've been sensitization training. So they've relaxed a bit to a point that they are allowing peer educators to go and train police officers on sensitization trainings on how to treat people who use drugs. And even police officers are even using their own discretion, as opposed to just arresting people who use drugs. They are referring them to centers that can help them with their issue or their problem. And so we are slowly moving towards a more human rights-based approach, especially through our National Drug Master Plan, which has basically made provision for harm reduction services. And so there's been discussions on guidelines on how exactly the country can go about administering harm reduction services to people who use drugs and people that need them.
Yeah, thank you so much, Charity. Yeah, this question goes to Mrs. Maria. The question says, what part does public protest play in policy making, and how can protest be helpful, and in what ways can it make progress more difficult?
Thank you very much, Moronfolu, for this question. And I think public protest to some extent can be helpful, and it could also not be helpful to some. So I'll say yes and no in terms of the kind of protest that is being used. For instance, we have had over the years, especially for instance, Support Don't Punish campaigns where we had floats and parade march and all that. These are peaceful protests in terms of maybe carrying placards with messages and moving to a specific institution to present our message. Yes, such protests, such marches have been able to yield good results in terms of having the audience to meet key policy makers. So for instance, and I think in 2017, we had a similar march where we had flyers, we had messages, and we moved through Parliament and through to various streets to share messages about the need for drug policy reform in Ghana. And now, such protests are very healthy protests, and of course, should be able to give audience for some steps to be taken. However, if you are engaging in a very hostile environment, you are in a hostile environment where protests could lead to chaos, I will not advise that you should adopt such a strategy to address specific issues around drugs. Because, of course, even drugs themselves are being labeled and seen as something that society even fronts on. And so when the environment is very hostile and you intend to use such measures, I will advise as an advocate, it is not the appropriate medium for such advocacy too. So you need, as an advocate, you need to first of all know the kind of environment within which you are operating, and also know the kind of audience you are dealing with. And based on that, you can advise as to whether you will want to go with public protest or you will want to go by another means. But where the environment is very hostile, it is not the best means to use. But of course, there are protests that have been used and it has yielded a number of good positive results.
Thank you so much for that awesome response. Yeah, Charity, this goes to you. What advice would you give activists deciding if an incremental change is good enough to support?
I think, as Maria reiterated, don't give up. Find a worthy cause. I mean, anything that is relating to human rights is worth fighting for. Whether we are using people who use drugs or gender-based violence, find a worthy cause that is worth fighting for, and hopefully something that you can easily get allies on. So, I mean, with people who use drugs, we've had to tailor our message in such a way that it becomes relevant in areas of HIV, areas of TB, areas of hepatitis, human rights. And so you need to be very strategic at how you identify your cause and what you advocate for, and make it in such a way that it stays relevant and it doesn't die out. And so, yeah, that's very important, finding a worthy cause that is relevant and easy for you to get allies.
Yeah, thank you so much, Charity. And this question goes to the both of you. It said it's been so informative to listen to you all. Does drug policy in Ghana and South Africa drive migration out of the countries?
Maria, would you like to?
Does drug policy drive migration?
Out of the countries, yeah. South Africa and Ghana. Yeah, okay, so both South Africa and Ghana.
If I understand the question correctly, the person is asking whether looking at the drug policies that we have, does it influence to some extent migration? Is that the case?
Exactly, yeah, sure.
Now, when we were doing the study on the 16 ECOWAS country drug laws, one thing that we identified with the laws was that there was huge variation in terms of the punishment or the sentencing regime and all that. And what that does when there's that variation in laws within the same region, what it does is that it allows for a certain movement. So for instance, people who will want to use drugs will try to identify countries that have very relaxed rules or laws, and that could drive some kind of migration towards that. And that is why we advise in the model drug law that the region needs to harmonize its drug laws. Because if you harmonize the drug laws, then it helps to address issues also as well. I mean, issues around migration, and all those kind of issues. So, of course, variation in the laws does that. And of course, within the region, there are some countries that the laws are really, really very not too punitive to some extent, because if you have for professional use, it doesn't really attract that. So, of course, you'll find that people will want to move drugs towards that direction, and that could sometimes create a lot of problems or challenges within the sub-region. So, of course, one of the issues I want to hammer more is that there is need for harmonization, and that harmonization we echoed it in the West Africa Commission on Drugs model drug law, and that this must use that as a model, as template to guide, so that at least we are all on the same template, not necessarily the same issues specifically, but at least it gives a fair level and a platform that makes us to be able to move and address the issues uniformly.
I agree with Maria, and I mean, it's the case in South Africa as well, because of our not necessarily relaxed drug laws, but a lot of the drug trade is driven by people that are not from South Africa. And so your suppliers of heroin will be people from East Africa, your suppliers of cocaine will be people from Nigeria. And so the quality of substances even influences migration into urban cities from rural areas, and I mean across the continent as well, as Maria said. So it definitely affects migration.
Yeah, thank you so much. I was hoping not to see if we have more questions, but in that regard, I would love to take this powerful quote by one of the powerful influence in drug policy in the African continent, and that is Kofi Annan. He said, "I believe drugs have destroyed many people, but wrong government policies have destroyed many more." And this is still very relevant to the African context, and also there are some part of the world that are facing this reality. So I feel forward, we have to take this upon our shoulders to see how we can challenge the status quo, how we can create the change Africa really needs. We are getting there. This is not how it used to be. Ready for the African continent. So, President, for finding time to attend our SSDP 2020 conference, and I hope we are going to be working more with charity in South Africa in coming months. And thank you for coming, Mrs. Maria. Thanks for always being there. We appreciate your presence. For always being there for SSDP in Africa, we appreciate you and hope to continue working with you. Thank you so much for coming, and do have a wonderful night rest. And bye for now.
Thank you so much.
Thank you so much. Bye.